said, I just want to remind people that this is a live web chat. I'm speaking with Erica Johnson, Director of Rehab Services at Baptist Health Nursing and Rehab Center, and we're talking about dysphagia, difficulty swallowing. And we'd love to hear from you. We'd love to have take your questions or your comments right here. You can reach us by email, chat@cbs6albany.com, or through the CBS 6 Facebook page. So, Erica, please show us what you have.
Now, I wanted to explain, when someone is given the diagnosis of dysphagia, they will be referred for treatment, typically to a speech therapist, for treatment. Then when the speech therapist performs your evaluation, they will be able to determine if this will be a viable option for you. Now, what I'm holding here today is our actual machine that we have been using at Baptist Health. And this is the Vital Stim machine. There are different makes and models, but we chose to go with this portable model because that's what's best for our patients, because we can go directly to them in their room.
Go right to the bedside with it.
Right to the bedside, so if it's someone who's very sick, we can still provide this treatment if they're not able to get out of bed yet.
They don't have to come to the therapy room, right?
Nope.
Okay.
So when you go to use Vital Stim, there are these little electrodes that are placed on either the neck or the face, wherever it's needed.
Excuse me.
And then this is the machine that, when turned on, the speech therapist will determine what frequency you need and will set it to that frequency. And then this machine works in 1-minute intervals.
Okay.
So it will go up to the intensity, go back down, and then in another minute we'll go back up and then go back down. So it's gentle pulses of stimulation that goes in a frequency.
Right, which helps then the muscles work the way they would or should normally work, right?
Correct.
And helps to induce a swallow, perhaps, that might not otherwise occur.
Absolutely.
Right? Wow, fascinating. Very fascinating.
Yeah, we're very excited to be offering this at Baptist Health.
It's great. It's just tremendous. And I know I spoke with a couple of our families that said that they didn't think their mother was ever going to be able to swallow again. And even a couple of folks, I believe, that had been on a feeding tube, that we were able to get them off of the feeding tube and able to swallow on their own again.
Yes, we've had great success since using this, and we've been using it since around the beginning of March.
Okay.
But I have 3 patients. The first patient that we've used it with, this patient came to us from the hospital on a feeding tube and wasn't allowed anything by mouth. And after our speech therapist, Ashley, had worked with her using the Vital Stim machine and then also using her traditional methods, she is now on a regular diet with thin liquids and
wonderful.
Has been off the feeding tube for 4 days. And with this particular case, we saw something that there haven't been any research studies done, but it is somewhat known as a side effect, a good side effect of the Vital Stim. When this patient came in, they were not able to really communicate, could maybe just speak in one-word phrases, and after a few treatments of the Vital Stim, can speak in complete sentences and can make all of their needs known.
That's amazing. That's wonderful. That is really, really exciting to hear.
Yeah.
And it's got to make you feel good. I know it makes me feel good. So.
Yes. Yeah. That's what we are here for as therapists.
That's what it's all about, right?
Yeah, I know Ashley worked really hard with this patient, and the patient couldn't be happier.
Wow, that's wonderful. Now, can you tell us a little bit about how Vital Stim is different from traditional swallowing therapy?
Sure.
Or do you use it in conjunction? Can you use both at the same time, or is it one or the other? Or go ahead. What can you tell us?
We will see the most success if we use this in conjunction with traditional therapies,
Okay.
which are, maybe the modification of the diet, downgrading the diet so that there's less of a risk for aspiration. The speech therapist can give you certain techniques on how to swallow properly given the weakness in your muscles, and then can also prescribe different exercises that will help build up the strength again in the throat and in the mouth. But we will see the most success if we use both of these together.
Together, okay, great.
Yeah.
Wow. And how long does it take for a patient to see results from VitalStem?
It can vary from patient to patient, but the research shows that within 6 to 20 treatment sessions, patients will see results.
It could be as early as 6, just from 6
To start
treatments.
to see
to begin to, okay,
Yeah.
all right, right. 6 to 20. Wow, that's amazing.
And from the cases that we've seen, our speech therapist has gotten them off of the feeding tube in about a month.
Wow.
Not completely, but at least being able
Sure.
to take meals in.
That's great. That's
Yeah.
amazing. Now, I'm sure a lot of folks may be wondering, and I'm wondering myself, are there any side effects from using the VitalStem?
There is only one known side effect,
Okay.
and that is if someone has skin irritation just due to the little adhesive
Oh, okay.
that's on the pads. These are the pads that are similar if you've had an EKG, where they
Okay,
put
yes.
the little
Yes.
sticky
Right,
adhesive.
yes.
That's really the only known side effect.
Okay, if you might have a little skin irritation,
A little
or if
rash.
you have an allergy, perhaps, maybe,
Yep.
I guess, and that would be evident right away. And,
Correct.
Yeah. Huh. Wow. That's really it, though.
That's
Yeah.
it.
Oh. And I imagine, and correct me if I'm wrong, but I imagine that it's very few people that even have a reaction to the pad that you just described, right?
Yes, I don't have, specific numbers,
right.
but I know for myself being an occupational therapist,
Right.
I've used a treatment similar
Sure.
to this on someone's arm, and, it's very rare that
It's
you
rare.
see
It's very
the
rare.
reaction.
Right. Wow.
Yeah.
Oh, I would have thought there might be something else, but
That's
that's
it.
great to know. That is
Yeah.
really great to know. Wow. Does insurance cover VitalStem at all, or is it
Yes.
something that people need to pay out of pocket for? Or?
Medicare does recognize the treatment of dysphagia and provide reimbursement for that, given that it's medically necessary and that it's provided by a clinician
Yes,
who is
right.
certified
I was
to
going
do
to say
so.
again, back to that, being administered by a certified clinician.
Yes.
Exactly. So there is coverage for that, and Medicare recognizes that.
They do.
That's great. Wow, that's wonderful. I'm sure a lot of people have been wondering that. So, and we talked about the positive results that we've seen at Baptist anyway with the VitalStem. And are there any other stories that come to mind, or anything else
Yes.
you'd like to share? Please,
I would.
please do. Yeah.
I have 2 more cases
Sure.
that we've seen really
Sure.
positive results with. One was a patient who came in for subacute rehab with us at the Homeward Bound unit. And when he came in, was not able to really speak because of the facial droop with
Right.
a stroke.
Right.
And with the use of the VitalStem is now able to communicate.
Wow, that's amazing.
Yeah.
That is just amazing.
And then we have another patient who was on a feeding tube. And through the use of therapies and the VitalStem, after about a month, is now able to eat 3 meals a day. He, is on a modified diet, puree, but, is able to take in food orally and not get all of the nutrition from the feeding tube.
Wow, that's wonderful. That is
Yeah.
wonderful. Tell me, may I just for 1
Absolutely.
second here? And as you can see, that this is just a very, very small unit. In fact, this unit really doesn't attach to the throat. This is separate. It's only
It's just these little, it's the pad
it's
that
the pad
attaches
and the electrodes,
to you.
right? Exactly, that attach to either the face or to the throat area, right?
Yep.
And how long does a patient wear this?
It depends.
If they're
Up
eating a
to-
meal, would they have it like
You
on
can.
an entire meal, or?
Yes, you can. I would say the typical wear time is about 30 minutes.
Okay. Oh, all right. So 30 minutes a day. Is it a day?
Yes.
Okay. About 30 minutes a day. Wow. Wow. Well, this has been fascinating, Erica, and I just cannot thank you enough for coming down today and explaining all about Vital STEM that is helping so many people with dysphagia.
Yeah.
And as we mentioned, we're using it at our Homeward Bound unit at
We
Baptist
are.
Health, and we've been seeing some wonderful results with it. And I just know that anybody that's watching that suffers from dysphagia, it's got to feel good to know that there's help out there.
There is.
And there are things that can be done. So anyway, again, thank you so much for coming down. Thank you, everyone, for logging on. It's always good to be with you, and I will see you next month. Have a great month. Thank you. Bye-bye.